Come in.
Hi, how are you? I'm Lisa. I'm going to be your nurse today. And how are you doing today?
I'm doing well, thank you.
Good. Nice to meet you.
Nice to meet you.
Let me go ahead and wash my hands first, okay?
Okay.
All right, thank you. Okay. How's the temperature in the room?
It's fine, thank you.
It's okay. All right. I'm going to go ahead and shut the doors for privacy and close the curtain.
Okay.
All right. So what I wanted to do is just go over your gastro and your muscular and your neuro system. I'm going to ask lots of questions. I'm going to go over your family history. I'm going to go over just different questions. If you don't know something that I'm asking you, please stop me. Or if you feel uncomfortable, please let me know. And please feel free to tell me anything because I've done plenty of assessments on different people and I just need the correct information. Do you need for me to bring a gentleman in the room while I'm asking these questions or when we start doing the assessment?
We can start doing the assessment. We're fine. Yes, this is fine.
No, but do you want a gentleman in the room?
No, you're fine.
Okay.
We don't need anybody else.
Perfect. Thank you. All right. So can you go ahead and tell me your name, please?
Carlos Soto.
Okay. And your date of birth?
2/14/79.
Okay. And what do you do for a living, Mr. Soto?
IT.
Okay. And tell me if you're feeling anxious or nervous or fearful at any time, and we can talk about it if any of those things you're feeling. Okay.
Okay.
All right. And can you tell me the year, the president, please?
2019 Donald Trump.
Okay. And do you know where you're at?
Medical City Hospital.
Okay. Thank you. All right. And I'm assessing the patient. He doesn't look like he has any cyanosis. There's no respiratory distress. He looks like he's breathing normal. Yes. Okay, so what we're going to do is, we're going to go over your history. Are you having any current pain right now?
No pain.
Okay. And what I'd like to do is go over some of your medical history. So can you tell me any kind of medical history that you have?
Diabetes, high blood pressure, high cholesterol, and sleep apnea.
Sleep apnea. And you have that type 2 diabetes or type 1?
Type 2.
Okay. All right. And how long have you had that?
About 9 years or so.
9 years ago. Okay. How about any surgical history?
No surgeries.
Have you been in any car accidents?
Yes.
Okay. And how long ago was this?
About 2 months ago.
Okay. All right. And are you on any current medications right now?
Atorvastatin, lisinopril, and metformin.
Okay. All right. And what's your dosage on those medications? 2,000
milligrams for metformin, 10,000 milligrams for lisinopril, and 20 milligrams for atorvastatin.
Okay. And that CPAP, you're on a CPAP or BiPAP?
CPAP.
CPAP. Okay. And do you use that every night?
Yes.
Okay. All right. And so what we're going to do is we're going to go into more of a focused section. And so we're going to go over the gastro information, okay? And how has your appetite been lately?
It's been fine.
It's been fine? Okay. And are you allergic to any foods?
No, not allergic.
Have you had any abdominal pain recently?
No.
No? How about any nausea or vomiting?
No.
How about your stools? Have you been passing stools normally?
Yes.
Okay. And have they been, what do those stools look like?
They're brown and they look normal.
They look normal? Okay. All right. And any constipation or anything like that going on?
No.
Okay. How much water would you say that you drink a day?
At least 40 ounces.
40 ounces. 40 ounces a day?
Yes.
Okay. And how about your last meal? Can you tell me your last meal, please?
Last meal was dinner around 5:30 p.m.
Okay. And how many meals do you eat normally in a day?
3.
Do you eat any snacks?
Sometimes, yes.
Okay. What would you say, like for instance, what was your breakfast today?
A cup of noodles, ramen.
Okay. And how about, did you have any snacks today?
Not that I remember, no.
Okay. And how about lunch?
A bowl of soup.
Okay. And dinner was, did you eat
Chara beans.
Chara beans. Okay. Is that like beans, like pinto beans?
Yes, pinto beans.
All right. Do you smoke or drink?
No.
No? Okay. All right. So what we're going to do is we're just going to go over the neuro section. Now, what I want to do is I want to go over, excuse me, let me back up. Does your family have a history of anything with the GI, like any um, Crohn's disease or verticulitis, herniations or hemorrhoids or irritable bowel syndrome or dumping syndrome or anything like that?
No, just diabetes runs in the family.
Okay, and no colon cancer or anything like
No
that?
colon cancer.
Okay. All right, and now we're going to move over to the neuro section. Have you experienced recently any headaches, migraines, loss of balance, loss of memory? I know you said you were in a car accident a few months ago. Have you experienced any weakness or numbing or tingling anywhere?
No.
Okay. How about any pain in your neck or body, your spine, your lower back, upper back, or middle back, or anything like that?
The shoulders and the upper back.
Shoulders and upper back. Okay. And what does that pain feel like?
It's like it feels like just like muscle soreness.
Muscle soreness. Are you getting treated anywhere?
Yes, chiropractor.
Okay. And how often do you go there?
Twice a week.
Twice a week. Okay. Does your family have a history of any strokes or any neurological problems?
No.
No, like brain tumors or seizures or anything like that?
No.
Okay, no family. Multiple sclerosis or anything like that?
No.
Okay. And when you got in an accident, did you seek medical attention immediately?
Yes.
You did?
Yes.
And did they say anything about any head injuries?
No.
Okay, no head injuries. Anything with your spine? Any injuries on your spine?
No.
Okay. All right. And now we're moving to the muscular system. How would you say that your muscular system is? Do you feel like you're weak or your strength is, would you feel, that your strength is weak, normal, or strong? Any arthritis, any problems with your joints or tendons or anything like that?
No, muscles are fine. They're
Okay.
normal.
Okay. And how about in that accident, were you, did you experience any broken bones?
No, no broken bones.
No broken bones. Okay. All right. So what we'll do now is, I just wanted to make sure that the temperature is okay. So we're getting ready to go into the assessment part of this assessment. And so what I'll need you to do is, if you don't mind, if you can go and lay in the chair. If you can scoot back and lay there. What I'm going to do is I'm just going to go and clean my stethoscope first, okay? Okay, so actually, if you can just sit up for me, I'm sorry, if you could just sit up for me. Thank you. And so what I'm going to do first is I'm just going to go ahead and inspect the skin. It looks like his color is correct for his ethnicity. Let me go ahead and assess your skin turgor. Let me just do this. What I'm doing here is I'm pinching the skin to see if there's any dehydration. If the skin returns back quickly, that means that there's no dehydration. And it looks like it's returning back quickly, so the dehydration doesn't look like there's any there. His skin is warm. It appears dry. Doesn't look like any lesions on his skin. It looks normal there. And so if I can go ahead and get you to lay down now, I would appreciate it. And how's the temperature in the room?
It's fine, thank you.
Okay. All right, and I have the doors shut for privacy.
Okay.
All right, so now what I'm going to do is I'm going to go ahead and get ready to assess the abdomen. So let me go ahead and get a sheet there for you so that we can go ahead and do that. Okay, I'll be right back. So what I'm going to do is I'm going to go ahead and raise, if we can just raise this gown up. Okay. And so what I'm going to first do is I'm going to assess the stomach. And so it's the abdomen. And so what we're going to do is we're looking for any lesions or anything like that on the skin. We're looking to see if the color is correct We're looking at the umbilicus here in the middle to make sure that it's midline, that it's intact, that it's normal, that there's no pulsations. If there's pulsations, that means it could be maybe an aortic aneurysm. And so everything looks good there. So now I'm going to go ahead, and I've already washed my hands. I'm going to go ahead and assess the abdomen. I'm going to listen first to all quadrants. I'm going to start on the right lower quadrant, and I'm going to work my way around. And let's see here. So let me know if this is too cold or anything like that, okay?
Okay.
All right. So what we're doing is we're listening just to make sure that there's movement, that there's peristalsis, that the abdomen, the intestines are moving. Okay, bowel sounds sound really good. What I'm next going to do is I'm going to go ahead and assess the abdomen on different quadrants to find out if there's any tympany that determines like the abdomen location of if the organs are in place. Okay, that sounds good. It should sound like that. If there is any kind of organs where you're percussing where there's fluid, then it should sound different. But that sounds normal, so that's good. What I'm going to do is I'm going to go ahead and I'm going to assess the abdomen now by palpation. So I'm going to do a soft palpation. Okay, I'm going to do it a little bit harder now. Tell me if that hurts. Does that hurt?
No.
Okay. Any pain?
No.
Okay.
No pain.
No pain? Okay, I'm just going to look at your abdomen for contouring and symmetry. So I'm just going to come around and I'm just going to look here. Okay, and that looks good. It looks symmetrical. It looks smooth. Okay. And so now what I'm going to do is I'm going to go ahead and listen to the vascular sites. You have 7 sites. It's the aortic, and then you have the renal, and then the iliac, and the femoral. Okay?
Okay.
All right. You want to use the bell of it because you want to hear if there's, it actually works better if you're using the bell versus the diaphragm. We're just listening for any breweries right now. Okay, I'm just going to roll down these a little bit. Okay. And what I'm going to last do is I'm going to go ahead and assess the liver, okay? I want to make sure that the liver is in place. So here you have the abdominal rectus muscles. So it's going to be lateral to the abdominal rectus muscles. And so I'm just going to go palpate right over here on this section. Does that hurt?
No, no pain.
Okay. Doesn't feel like the liver's enlarged or anything like that. That's what we're looking for too. If it is enlarged, then that would be maybe someone we would have to refer him to, maybe a hepatologist. All right, let me go ahead and wash my hands. I'll be right back. Okay, let me go ahead and assess one thing, okay? When I touched on that liver, was there any tenderness?
No, no tenderness.
No, okay. No rebound tenderness. There was no pain right now?
No pain.
Okay. All right, so now what we're going to do is we're going to go ahead and assess your neurovascular system. If I can just go ahead and get you to stand up for me, please. Okay. So what I want you to do is I just want you to walk towards me. Okay. Gait is straight, it's steady. If you can just turn back for me. Okay. All right, and just walk back forward. Okay. And then what I want you to do now is come back and I want you to walk on your heels and then your tiptoes. So you can walk like this and then you can walk like this, okay?
Okay.
So you'll just walk on your heels for me. I'm just looking for coordination and balance. Okay. And then if you can go ahead and walk on your tippy toes. All right, good job. Okay, great. Thank you. That looks good. All right, so now what I'm going to do is I'm going to go ahead and assess your spine. So what we'll do is if I can get you to turn this way, okay? And I'm just looking at his spine here. I'm going to just undo this real quick, okay? Spine looks aligned. Doesn't look like there's any kyphosis or any scoliosis going. I don't see any scoliosis or lordosis, so that looks good. I'm just going to go and close you back up, okay?
All right.
All right. All right, and then can you do me a favor, just turn around for me? All right, and then what I want you to do is I want you to put your feet together like this, and then I want you to close your eyes, and I'm going to stand behind you. I'm just looking for any balance or any coordination, any swaying. Okay. All right, now do me a favor. Oh, go ahead and open your eyes. And I want you to just hop in place if you don't mind. Okay, great. All right, so now what I want you to do is I want you to go ahead and put your hands on your shoulders. And I want you to just turn your
shoulders.
I'm sorry, on your waist.
Okay.
And then I want you just to turn this way. How does that feel?
It feels fine.
Okay, and then to your left.
It feels fine.
Okay. I want you to try to just go ahead and bend down for me all the way down. How does that feel? Any pain?
No pain.
No pain. Okay. All right. And if you can now, I want you to go back and extend as far as you can. Okay. How does that feel?
Feels fine.
Okay. All right. You can go ahead and stand back up. All right. So we're just looking for a range of motion. I know that you were in a car accident recently. Just to share, I'm just checking to make sure that you still have that balance and that range of motion. So that looks really good.
Okay.
All right. And let's see here. What kind of questions did you have for me?
No questions so far.
Okay. The last test that we're going to do is we're just going to check your knees. I want you just to put your knees up like this and then do the other leg. Okay. And then can you move your knees like this? Okay. Any pain or any pressure?
No pain or pressure.
No? Okay. All right. So now what we're going to do is now we're going to go over what my assessment, my findings are, okay?
Okay.
If you can have a seat, that would be great. Okay. So some of the things that I noticed GI-wise, I really want you to start drinking some more water. I know you said you drink about 40 ounces. And so a day, which is good. That's really good. We want you drinking at least 1 to 2 liters a day of water. And want you walking. I also noticed that you said this morning that you had a cup of ramen soup.
Yes.
And that ramen soup is full of sodium. So I want you to cut back on some of that salt. If you can, no more than 2,000 milligrams a day of salt. And let's see here. What else did I notice? You also, if you can, start eating snacks throughout the day. If you can at least try eating 1 or 2 snacks throughout the day, and something that's healthy, something that has fiber that's good for your digestive system. That will help with you processing foods. It actually also helps with the diabetes. So if you could do that, that would be good. What kind of snacks do you like, or what kind of fruits do you like?
Strawberries, grapes, apples.
Apples are very good. If you could do that, they have high in fiber, especially the peeling of that. And then also just maintain your diabetes and your blood pressure by eating less salt, less frozen foods. If you can, try to prepare your meals versus going out to eat all the time. Are you married?
Yes.
Okay. So have her try to see if she can maybe cook a little bit more, or if she's not cooking, because I know you said you kind of do go out to eat more. Or it sounds like you're going out to eat breakfast, lunch, and dinner. Is that correct?
Most of the time. Yes.
Most of the time. Okay. All right. And I also your medicine for your cholesterol atorvastatin that you're taking. Make sure that you're still taking that at night in the evening, because your body does create cholesterol, and that does help. Also checking your blood pressure. Do you check your blood pressure at home?
Yes.
Okay, so continue to do that, and you're not a smoker, so that's good. Make sure that you're not drinking any caffeine before you check your blood pressure. Make sure that you are not doing any exercises before you check your blood pressure, because that will also sway the blood pressure reading, and it will give you a false reading. Make sure your legs are not crossed when you're when you're checking your blood pressure. And let's see here. That metformin, you know that metformin doesn't lower your blood sugar. It just helps with the digestion. It actually helps with your intestines not absorbing that sugar as much.
Yes.
Okay, so it doesn't really lower your blood pressure. Let's see here. If you start having any nausea or vomiting, because metformin does, one of the symptoms, side effects of metformin is that it can cause an upset stomach. So if you start having that, just make sure that you're still replenishing your body with lots of fluids, especially a lot of electrolytes, because when you go to the restroom and have a bowel movement, you lose potassium, and that's a really important electrolyte for your body, especially for your heart. Okay. And let's see here. And you haven't had any pain and no migraines, no dizziness or anything like that.
No.
And just still keep on seeing the chiropractor as you've been doing. And if you have to take any medication, make sure that you don't take any Tylenol, no more than 4,000 milligrams a day for that accident that you had. And if you do start having any symptoms of dizziness, or you have like vertigo, that's what they call it, vertigo is dizziness, then please seek medical attention. Or if you're having problems breathing, or you have constant nausea and vomiting and you're not able to keep any food down, then please seek medical attention, okay?
Okay.
All right. Did you have any questions for me?
No question for you.
Okay, well, thank you so much. It was really nice meeting you.
Thank you.
Thank you. Bye-bye.
Bye-bye.